I've been studying nutrition for about 9 years, or almost 9 years. And my question to you is, for somebody that's wanting to start a coaching business in the field of health and nutrition, what advice do you have?
For somebody who's going to start a business in health and nutrition? Is that what am I?
Yeah, that's right.
Am I hearing it? Yeah, I would. Well, put yourself in develop a relationship with somebody who's already been successful at that, and they would, because that's, I'm sure, can be a fairly competitive business, and there's going to be all those nuances and hoops to go through that somebody else has already been through them, and if they're willing to develop a relationship with somebody who has this going successfully, in all likelihood they'll want to help you, and they would be in my mind, they would be the people who would have the greatest innate knowledge about how to do this.
Thanks very much, Doctor. And now, forgive me, I'm not sure if it's Stefan or Stephanie. Welcome.
Hi, Doctor. How are you? Can you hear me?
Yes.
Oh, great. Thank you very much for the talk. It was really insightful and knowledgeable. Thank you for that. I guess my question is, what's a good test for someone in their mid-40s who's completely plant-based, but still experiencing shortness of breath and fatigue for their heart health? And then when you are talking about eating the greens, can it be steamed and can you have a lemon with it, or does it have to be raw when you eat the greens?
No, steamed is fine.
Okay.
And what was the other part of the question?
Yeah, sorry, just a good test for heart health for someone who's completely plant-based in the mid-40s.
Yeah, well, there's a number of, probably the easiest and straightforward would be to get a calcium score. Calcium score was just a sort of a CT X-ray of the chest, and if you've got some blockages in your arteries that have calcified, that'll show up, and then you can be motivated to make some significant lifestyle changes.
Thanks, Dr. Esselstyn. And coming up now is George. Welcome, George.
Thank you, Dr. Esselstyn. Can you kindly comment on whether the caffeine in 1 or 2 grams of matcha green tea would damage our endothelial cells?
I don't have information that green or black tea can injure endothelial cells. There are 2 studies showing that the coffee with caffeine will injure endothelial production of nitric oxide. The Italian study is the one I usually refer to, and that's where they took a group of healthy young subjects, divided them in half. One half drank coffee that was decaf, the other drank coffee that was caffeinated. Then they would do the brachial artery tourniquet test after they drank, and then they would switch groups. So the group that previously was having coffee with caffeine was now decaf. It was always the group that had coffee with caffeine that injured endothelial cells.
Got it. Thank you very much for that. And up next we have, I'm going to ask Ivan to unmute. Let's see if there we go. Hi, Ivan.
Hello, can you hear me?
Yes.
Thank you, Dr. Esselstyn. I have a question for you about the use of Viagra, sildenafil, for people with blood vessels, damaged blood vessels. Have you used this medicine? Are there secondary effects?
Well, it's an interesting question, and I think things like Cialis and Viagra have helped some patients who are having difficulty, and I really pretty much like to defer all that to a urologist who has a special interest, because I think it's important to look at all the aspects of what causes erectile dysfunction and have those sort of safely monitored by somebody who has a special interest in that. And there are urologists who do that.
Thanks very much for that. And up next, we have Steve. Welcome, Steve.
Hello,
Hi, we hear you. Thank you.
you can hear me, yes?
Mhm.
Yes, Dr. Esselstyn, I just want to ask, the CT scans that you do, wouldn't there be a lot of radiation going into the body while the process is going on?
Well, yeah, it depends what you're, yeah, but just for a CT scan for the chest X-ray to identify.
Yes, that's right. That's
To identify whether or not you have coronary artery disease, I really think that it's modest enough radiation there that with the information that is gained is certainly appropriate. I wouldn't feel you had to do this on a regular basis though, but because once people understand that they have got documentation, this is even if they don't have any symptoms, that they've got documentation of early coronary artery disease because of these calcifications that have been identified, that often is an inspirational message to them that makes them appreciate and understand that, by golly, this is serious. I better get down to work and go to work on this. Now, if you do on a regular basis, you do a nuclear stress test. I think there are many who would agree that you don't want to do too many of those. Then the radiation does get high.
Thanks very much for that, Doctor. And up next, we have someone with the initials VT. We've just asked you to unmute if you can. Try that one more time. VT. Something's not quite working there, so we're going to go on to Steve. Hi, Steve. Welcome. Or Stephen.
Thanks again to the moderator. I appreciate it. I met you once, Dr. Esselstyn. It was just a great honor. You were at Rochester speaking. I've been whole foods plant-based for over a decade. I read the China study. I read your book, and it's just fantastic what you've done for health in this country. My blood pressure's good. My weight is close to college weight. Everything's good. My cholesterol bounces between 154 and 180. I'm whole foods plant-based, no added oil, little salt, little sugar, not much. You got any opinions on that?
Well, I think you're gonna be fine. You know that the thing that's interesting is that if let's suppose that I get 1,000 patients who would totally follow our program, 100%. There would be some who would have a total cholesterol of 102. Some would be 120, 140, 160, 180, 200, 220. Everybody has a different thermostat on their liver. We all need cholesterol. Every single cell membrane in our body is made up of cholesterol in the wall. So it's the foundation for our sex hormones. It's a foundation for vitamin D. So, and I just know now that even though somebody has a cholesterol in that range, if providing they are eating 100% plant-based, they are building an endothelial fortress. Even if you've got a few extra molecules of cholesterol, you cannot injure your endothelium because you're making it so healthy by how you're eating. Now, the other way that you can kind of confirm what I've said is whether all your inflammation is gone or under control. You can ask your cardiologist to get a blood test for cardiac inflammation, things like HSCRP and myeloperoxidase.